If you've been sitting there thinking, I don't know if I'm ready for the meds journey yet, or your kiddo just can't tolerate them, listen up. NeuroNeeds was created by a medical geneticist, board-certified pediatrician, and ADHD dad who hit the same wall when his own kiddo couldn't handle stimulants. He built a science-backed line of nutritional support to help fill the gaps where meds just can't. So if treatment feels scary or you're not sure where to start, NeuroNeeds might just be the middle ground your family's been looking for. Learn more at neuroneeds.com. All right, parents, grab your coffee or something stronger, no judgment here, because today's episode is about anxiety. You know, the sidekick that ADHD kiddos never asked for, but somehow she always shows up. I've got the amazing Dr. Laura Van Schaick-Harman here, founder of Meaningful Psychological Services. She's a licensed psychologist, school psych extraordinaire, and board-certified telehealth provider. Translation? She literally helps kids, teens, and families all over the country tackle anxiety, tics, sleep struggles, and the kind of spiraling thoughts that make you want to hide in the pantry with your kids' homework. Today, we're diving into practical strategies, mindset shifts, and no BS advice for parents dealing with anxious ADHD kiddos. So, buckle up. It's going to be real, relatable, and maybe even life-changing. Let's welcome Dr. Laura to the mic. Dr. Laura, welcome to Chaos and Caffeine.
Thank you so very much for having me. I'm so excited. I haven't done a podcast interview in several years. And
Really?
yes, yeah. And I think this is like my first big official going to be on multiple different avenues for people to access podcasts. And
Ooh.
it's so funny. I never was a podcast person a couple of years ago, and then my husband suggested I start listening. And now I'm a podcast fan, and it fuels my book buying habit. Uh, but I just eat it up. So I'm so happy to be here, and I hope it's helpful for your listeners.
I am sure it will be. I am honored to have you as your first podcast episode in years.
Mhm.
Dr. Laura was actually a sponsor in a previous month, and my audience, you guys ate it up and begged for more. So now we have her live, and I am so honored.
That's so wonderful.
For anyone who missed the episodes where you were sponsored in, do you mind to tell the listeners who you are?
Absolutely. So I go by Dr. Laura. The story there is my last name is pretty complicated. So my maiden name is Van Schaick. That's how you pronounce it. And then when I got married, I decided to hyphenate, which is Harman. I got my doctorate right before I got married. And I felt that I had earned and I'd done all that work with my maiden name. And to drop it like a month after would have been sort of silly. So I decided to hyphenate. And then I realized, well, that was not a great idea for being in private practice and have kids try to pronounce my name. So now I go by Dr. Laura, and it is much easier that way. So, hi, I'm Dr. Laura. I am a licensed psychologist. I live in New York. I have a private practice, and I treat children, adolescents, adults with a variety of different issues going on, mainly anxiety, anxiety-related disorders, OCD. I also do treat ADHD, tics and Tourette disorders, insomnia. And I also like to help college students with that big adjustment from high school to college, and then college into if they choose the workforce or whatever is next for them after college. So I especially like that population. And I like working with younger kids as well, elementary school. I used to do preschoolers until I had my own kids, and then I realized, whew, I need a little break from so much little at that time. And right now, all my work is virtual. Before COVID was about, let's see, 70% virtual, and I did have an in-person office. And then the pandemic arrived, and pretty much everybody was going virtual, but I was one of the few in my area that was already practicing virtually. So I had not too much of a difficult transition and then just decided full virtual had so many benefits for both myself, for my practice, being a mom, and also making it easier for my clients. And let's see, I'm sure we'll learn more about me as we go along, but I think that's my long-winded intro.
Thank you for that. Not to ADHD derail the conversation, but what led you to want to work with college students on the transition?
Hmm. So when I was at college myself, my undergrad year, I went to a small 4-year school and I just had a great experience myself, but I was like all in, drink the Kool-Aid as they would say. Like I was like school spirit. I was all in. Not everybody was. And I saw people around me struggling a bit and wanting to help them and be a support for them, and just knowing that there's another part of college life and it could be difficult for some people to access that. I started to think this might be helpful. There might be a need here. And also the school that I went to, which I actually teach at now and I love, is a commuter school. So I did not go away to school. And I had people that would come to that school that had went away and could not maintain that level away from their parent and then ended up coming back home. And when I was at college, I had a relationship with the admissions office, and they suggested they put me into speaking at open houses. And I did not know that I was capable of that. Turns out I was. And so I was on stage in front of all these prospective, students and parents, through this professional relationship with the office. And I just loved it. I love fielding questions. I love talking about how to really make college work well for you, how to have a great experience, that you don't need to get as far away from your parents to have a good, meaningful time during that early adulthood year. And that was really what kind of pushed me into really liking that population. And then when I was in graduate school, I did do an internship at a college counseling center. And I loved that too, because there was such variety of issues and dynamics at play there. And students would come in and really have a need balancing, trying to focus on classes, but they might have some other things going on in life. And now I definitely see there's so, especially when you're dealing with anxiety, it's a big anxiety trigger to be separate from the predictability of high school to the independence and the unpredictability of what college will be like.
Yeah, I love that. I can imagine that a few of us are raring and ready to go. Get me away from here. I want to go see some things, but that transition is probably jarring for most.
Mhm. Some people can stick with it, and it's so rewarding to see when somebody has that difficult start and work through the anxiety and stick it out if it is truly the right fit. So, a lot of times we see this with anxiety treatment. We want to look at what's to be expected as a response versus what's excessive as a response. So it is to be expected to have some level of nervousness, some level of unease when you're making a big transition like that. But if we're having panic attacks and now I'm not sleeping and I'm not eating and I want to just like leave, 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 now we're dealing with an excessive response. And we have to look at, is this a poor fit truly for you, or is this just different and new and you're not yet sure how to handle it? And we can learn some really good coping skills and learn a way to actually identify and manage the anxiety so that we can calm that down. And then when you get through that, it's like amazing to see the difference in somebody who can go on to stay at their chosen school or whatever, even if zooming out from college, whatever the situation is, can stick that out and then they grow. You grow. I love seeing people grow. You grow so much, and it's so rewarding as a professional to be there to support them in that.
I bet so. Okay, mamas of sensory seeking, constantly moving, touch craving kiddos, listen up because I've found the holy grail of calm. It's called Ted Kangaroo, and they make sensory products that are actually beautiful and built to last longer than my patients on a Monday morning. But the real MVP, the sensory squeeze seat. It's this genius compression chair that literally feels like a hug for your kid's nervous system. My son says it's like a great hug that rocks. And honestly, he's not wrong. It gives just the right amount of deep pressure without making him feel trapped. And here's the thing, every single kid that comes to our house, they all want to turn every single time. It's washable because kids. It's sturdy, and it's become our go-to chill spot for meltdowns, homework, and those 5 minutes before bedtime chaos moments. So if you've got a sensory kiddo who needs comfort, grounding, or just a little peace in their body, go check out Ted Kangaroo. They're out here helping our kids feel safe, supported, and seen, one squishy hug chair at a time. So I may be really off base. You've mentioned anxiety already. Of all of the comorbid situations that can happen with ADHD, anxiety makes the most sense to me since our brains are up there running at full speed with barely any breaks. Anxiety and ADHD makes a lot of sense to me.
Yes, we do see that often comorbid, and especially when people get a little bit older, so adolescents, adults, they become aware of those challenges, whether it's inattention or just being fidgety. So having some of that activity level, and they might come in to work on, I'm antsy, I can't sit still. And that could look a lot like anxiety because we see that in that population too. But we also see that in somebody with the hyperactive component of ADHD. And if you have that awareness of I'm distracted, I'm in class, or I'm in a meeting, or I'm at work, and my mind is thinking of this and is thinking of that, now we might see some anxiety like I missed something. Are people noticing that I can't pay attention? I'm falling behind because I missed all of that. I was just looking out the window. Yeah. Have you had that experience too, and people that you've like spoken to through your podcast?
Yeah, and another thing that I think layers it on is the anxiety of possibly people noticing that we're masking.
Mhm.
I'm not sure if I'm saying that correctly, but so much energy is put into being quote unquote normal. And
Mhm.
I feel like I see people with that anxiety of, oh my gosh, what if the mask slips? Or what if people notice that I'm working extra hard just to be in the same space and be quote unquote normal? I think that that has a lot to do with it.
Yeah, I see that often with parents that I work with when their kids are working so hard to quote unquote keep it together
Mm,
during their school day. And then they come home and they just sort of unravel or let
yes.
it out because it was so hard for them to try to keep up with all the demands and the expectations of their day. And then they just come home and it's like, well, I'm running all over the place and I'm irritable and I don't want to sit and do homework now. Um, and they're like, I don't understand how you can do this in school, but that at home. But it's quite common. It is very hard work when you're trying to manage redirection, and the normal brain, the non-ADHD brain, gets distracted too. So be kind to yourself and show yourself grace because we all days off. That's the brain needs breaks. And something that was so notable to me early in my career. I was in a workshop for ADHD, and the presenter was an ADHD specialist and said that it was basically misnamed, that we call it the disorder of inattention, but it's really the disorder of too much attention. And that
Mm,
stuck with me. And when I work with individuals with ADHD, I point that out that it's you're paying attention to so many different things, and it becomes problematic when the expectation is to pay attention to this one thing. And that's where the issue comes in. So it was just notable to me.
yeah, I like that. Sounds correct to me.
Yeah, yes.
So before I dive into the millions of questions I have on anxiety,
Mhm.
walk me through how you can see clearly what is ADHD and what is anxiety and what is both.
Hmm, that is a great question. So for me, for my practice, if ADHD is suspected, we would refer for a neurological or neuropsychological evaluation. Sometimes people will use the term ADHD, they do that with OCD too, very lightly. Oh, that's my ADHD. Oh, that's my OCD. And we try to caution the general public, like, it's not necessarily that because there are people that have been formally evaluated and are actually looking at the neurological component. So ADHD looks behaviorally symptomatic. So we might be looking at hyperactivity, so the as driven by motor, inability to sit still. People are like the bing bang boom, like I'm here, I'm here, I'm there. Others will describe it as I can't focus. I'm thinking of six other things every time that I'm in the classroom setting, or I can't remember what I read. I can't remember anything from what the teacher said, the conversation that I had. I'm irritable because that's a symptom too. I have trouble sleeping. And a lot of those can also kind of co-occur with anxiety as well, where people are thinking of, they're worrying. So they're distracted and they're thinking about different things. They have a lot of, they're fidgety, they're antsy because I'm uptight, I'm on edge, I can't sit still. So I feel like I've got to move, and movement is helpful with anxiety too. Generally, people find it that the repetitive movement is calming. So we can't just diagnose on behavior alone because we run the risk of misdiagnosing. So if there's a suspicion for, we look for the symptoms, we look for the age of onset because ADHD typically isn't going to just be like, I'm 25 years old and all of a sudden I have these symptoms that were never present when I was a teenager or a
Yeah.
child. And it really is a strong neurological component to this diagnosis. So for me, I would refer out to a specialist and they would do a large battery of tests to yes or no that as this is what the cause of the behavior that you're seeing it is. And typically on those types of evaluations, they will also look at anxiety, depression, maybe OCD, autism. So some of those other diagnostic considerations as either rule ins or rule outs and see if one better explains what we're seeing than the other, or if there's enough to meet criteria for more than one, which often happens. So I wouldn't diagnose somebody in my practice with ADHD. I either refer out but people come to me after they've been diagnosed or evaluated and they need treatment. And it's like I'm having trouble, like I forget, I see it, they forget their appointment. Those people, they forget when their appointments are, they're late, I miss my alarm, and then I'm missing class. Like I can know when treatment's been effective because we stop seeing those behaviors in front of, we show up, we remember, we have a system in place. So usually that's a good diagnostic tool to, or a point to refer out when I start seeing those behaviors early on. Like I notice you're forgetting appointments. Are you forgetting other appointments? Are you just conveniently avoiding therapy? You know what? So we go there. In therapy, we go there. We ask very specific questions to try to get the most information to inform the best decision.
Maybe I have avoided therapy in the past.
Therapy is hard work.
It is hard. It is
Yeah,
very hard.
yeah. It's so brave for people
Yeah.
to come to therapy. Not everybody does, but when they do, and if you stay with it, if it's appropriate for you, if the fit, the goodness of fit with the professional has to be paramount in your decision making. Because if you don't feel connected to your therapist, you're not likely to get much better because you're not feeling that trust, that connection, and somebody kind of like cheering you on, or you're comfortable enough to be vulnerable, to really share these very private, vulnerable parts of your life with somebody. But if you
Yeah.
can get that connection, that therapeutic relationship matters so much, and you put in the work, and I'm happy to talk about all the work if you'd like, but you put in the work, and I've seen just and heard of amazing change in people.
I agree. It is scary, but in the 5, 6-ish years that I've been working on myself, I cannot vouch for it enough. I recommend it to everyone, and most
Mhm.
of them deny me. They're still not ready, and that's fine. Okay, ADHD parents, if you've ever said, I just need one thing that actually helps us stay on track, I've got you covered. Meet Pop Sugar Cafe Printables, the creative powerhouse turning chaos into calm, one gorgeous, brain-friendly printable at a time. Pop Sugar Cafe isn't just about cute designs, though they are stunning. It's about giving neurodivergent families tools that work. Visual schedules, emotion charts, routine planners, and positive reinforcement systems that make everyday life feel doable. These printables aren't built for Pinterest perfection. They're built for the real life mornings with missing shoes, cold coffee, and a kid who suddenly hates pants. So if you're ready to swap the daily overwhelm for something that actually supports your family's rhythm, check out Pop Sugar Cafe Printables. Because structure can be beautiful, functional, and ADHD friendly all at once. Yeah, I kind of do want to dive in a little bit to the work. One of the things that, like I said, anxiety comes up in 2025 over and over again. My kiddo is 10. I'm not sure if it's that he's living in a world that did not exist when I was 10,
Mhm.
or if he has generalized anxiety from mom and dad. But I would kind of like to dive into how we can help our kiddos in 2025.
Mhm. That's a great question, and I definitely have a lot of thoughts on that. So let's see. First, as a parent, parenting is the hardest job I think anybody will ever have.
Mm.
And I used to think I knew a lot about behavior management and parenting before I became a parent because I was in private practice before I became before I became a parent. And then I became a parent. And then I said, what did I know? There were so many things that, yeah, this is what the training says, and this is what our research says. And applying that, I think just, like take out the sticker chart or, just tell them like once and stick to it. And then you realize like when you're living it, it's so much harder because when you're parenting, and this is I think one of the best things that we can do for our kids is love on them and be a strong support, not striving for perfection, moms and dads, because we get frustrated. We're human being too, right? I get frustrated. We all get frustrated. It is hard work. But when you form good at strong, we call it secure attachment with your kiddos, and I read somewhere it's like if you're there for them with the little stuff, you'll be there for them with the big stuff because it's always big stuff for them. So when it's a 4-year-old that's really upset about the color of their socks or the food, they don't want to eat that. And you're trying to support them through that. And sometimes this is a have to, and this is a choice. And making that decision is very hard in the moment. You think it's simple, but it's not when you're in the kitchen or trying to get out the door somewhere. But consistently showing up for your kids teaches them I can trust my mom and I can trust my dad. So when they're out there in the world and they experience anxiety and they don't know what that is, they know I have somebody that I can go to and tell them what's going on because mom and dad are their first trusted adults. And hopefully it's a healthy, secure relationship that they know somebody's got me and will take care of me and protect me and get me the right help or teach me the right tools or put me in the right program or teacher, school, like have those difficult conversations. So I think first and foremost, parenting is so important and it matters. And working towards showing that love and that consistent support for your kids helps so much with anxiety. So that's one piece. Another piece here is there's so many factors existing in the world in 2025 that were never a factor when we were younger. And I'm sure our parents said the same thing about their childhood too, because life keeps progressing, technology keeps progressing. For us and our family, I have an 11-year-old and an 8-year-old boys. They do not have cell phones or tablets. We do have like a laptop Chromebook that we use for school, but They are not given free access to that, and we don't allow smartphones. Many young children do, and it becomes problematic because the content is not always known to mom or dad or
Yes.
teachers, and it spreads so quickly. And as much as you try to protect your children, they will be exposed to things that are harmful and scary and anxiety provoking and problematic. So I definitely think our screen use and screen time is contributing to anxiety. In New York, we recently have a change in legislation where cell phones are no longer allowed in schools. And I do
Yes.
think that while it's difficult, I do think that is the right decision to make for the mental health perspective, because what I was seeing over the years, pre-COVID, during COVID, teens, especially texting their parents when they felt anxiety. And because as a parent, you love your kid so much, we hate when they're uncomfortable and we want to rescue. And I know this too as a mom. You want to rescue, you want to take their pain away, you want to remove that discomfort. So parents were going to pick up their kids. Just, okay, you're anxious, I'll come get you. If they're like, Mom, I don't feel good, come get me. So now they remove their kid from this situation that was safe, but they felt a little uncomfortable. So the child didn't learn to sit with that discomfort for a little
Mm.
while before getting rescued from that discomfort. And when that happens, and this is one example of this is how anxiety manifests, by the way. We feel anxious. It's a bad feeling. I don't like that feeling. I want to get out of this feeling. So it leads you to want to either escape the situation that you're currently in or avoid going into that situation ever again. And when you escape or avoid, the term in behavior in my field we call escape avoidance conditioning. Conditioning meaning learning. You teach yourself that you can't be in that situation. So the next time you're faced with that, so if school or work or a drive in the car or a date, you're likely to experience that same discomfort again. And you're again going to want to leave. And then you're probably going to leave again because that's all that you know. So we work on helping, and this is so difficult for parents, and I get it, is mom and dad, you sit with your own discomfort that your child is uncomfortable because this will pass. It does. We're not talking about a dangerous situation here. They're in a safe situation. They just feel maybe they have a test. Maybe they feel like I hate this situation. This is new for me. I don't know anybody. Like they're legitimate concerns, but they're safe. If we're safe, we stay and we wait it out. Because once you wait it out, so mom and dad, you don't go pick them up from school. They're not actually sick. You don't rescue them from that team. You don't quit their job for them. You don't email their professor for them. These are things that I've seen, right? You don't do all that for them. And the discomfort passes, and then you're much better able to make a logical, rational decision at that time after that discomfort's done. And most of the time, people are so much, they think they're so much better. They say, wow, I'm so glad that I stayed because I would have missed out on all this goodness. And if you can catch that early, and it's so paramount with anxiety treatment, you want to stick it out. And when we're treating OCD, so OCD is obsessive compulsive disorder. It used to be viewed as an anxiety disorder, and in fact, anxiety is a common symptom of that. But it's more of like a neurosis sort of component here too. But we do this in that treatment too. It's called exposure therapy. So it's similar. I'm sitting with this. I'm faced with this uncomfortable situation, and I'm teaching myself that I can sit with it. And it might be something like not wiping down my phone after I come home from work, or it might be tolerating the color of a shirt and that matches or is different than a color of my book. And again, these are very real, very distressing situations for people. And we would say you don't even need to cope with that. You just wait. You just wait, allow it to get intense, and then it will come back down. And it's beautiful to really help somebody with that. But as a parent, you have to have a strong gut, or at least deal with your own anxiety. Let your kid rise and then come down, and be with them and encourage them and support them. You're doing great. I love you. This is anxiety, this is OCD. You identify it for them. Remember, you've got the skills, you wait it out. And then further along in therapy, we also teach lots of coping skills. I feel like I'm sharing so much, but I can go into coping skills too if you'd like.
No, I love that. I love that you said if we're safe, we stay.
Hmm.
I also love that parents can work on their anxiety by sitting with the anxiety of their kid having anxiety. We're working on it as a family.
Oh my gosh. I had a mentor once who told me early in my training that having a child is like your heart walking outside of your own body. And it's so true. And you don't really get that, I think, until you become a parent and you feel their hurt,
Yeah,
right? You feel their pain, you feel their anxiety, and you love them so much. And that's a good thing. And it's so important to not alleviate that for them. And we're not
yeah,
talking about they're sick and they need they need Tylenol because they have a terrible headache. That's okay. Like then that's a good reason to alleviate some of that pain
yeah.
for them, but not because I'm scared to face this fear. My older son just learned to ride a bike without training wheels because he was so anxious and it took a long time, but he did it. Um, and now he can ride and then inspired another friend and his
Ooh,
little brother. And now the neighborhood, now we've got a whole bunch of boys. That's anxiety provoking for us in another way, but they're riding around the neighborhood, which I just love because we faced a fear.
yeah,
It's uncomfortable. And there were times that I was like, just forget it. Like it's not happening today, but it was like, keep with it, keep with it, keep with it. You learn it, you learn a new skill, and then you're so proud of yourself. And you'll
yeah.
be so proud. You're proud of yourself as a parent for sticking through the discomfort. And you'll be so proud of your child for
Mhm.
them sticking through that discomfort. And then the next time they're in another situation that's different, but they have that similar feeling, we teach. So in therapy, we teach, let's quickly assess. Is this a safe situation? Is this an unsafe situation? Because the purpose of anxiety and fear is to keep you safe. So sometimes our bodies send false alarms and false signals and cause you to feel so bad. And that means, oh my gosh, this must be dangerous. But we're not talking about you're going to walk down a dark alley at 3 a.m. by yourself or try to beat the train coming. You should not do those things. And you should have an appropriate high anxiety response and not wait that out and be like, I'm going to do it anyway. No, that's unsafe. You leave, right? You get yourself to safety. That's anxiety and fear working properly. But many people, the anxiety rises. With our screens and with our smartphones and with social media, I see a lot of anxiety, especially in girls, because there's comparison. And then they're taking like hundreds of pictures of the one picture and editing it to post it to get the perfect shot or the perfect angle and filters on it. And we see it with boys too, because like, oh, they're invited to here and this party's going on and that thing's happening and I wasn't there and my friends got there and they're all sharing this too. And then of course there's bullying that happens behind the scenes and so many different accounts, but all that sort of like that unknown, anxiety hates unknown. So it fuels that. So now we have people that are teenagers that maybe never had anxiety when they were younger, and all of a sudden to them, they feel what's going on and now they're uncomfortable in these situations socially that they weren't uncomfortable in before because now they're dealing with comparison, thinking about themselves compared to other people, what other people are posting. So it's a very tricky world in 2025 with the technology that's available, and all these kiddos, and we will live through a pandemic. And I don't want to discount like that was very anxiety provoking for almost everybody, and they're so resilient to go through that. And I think when that happened, my boys were 5 and 2, much younger, but now they're older. And I think, oh my gosh, if this were to happen when they were this age, I see now more clearly how hard it would have been
Yeah.
and how for those ages, for those middle school and high schoolers to lose their schooling, their activities, not be able to see their friends, like all these things that were good and healthy for them, they didn't have that access. And many college students who I work with too were now trying to figure out like a remote learning. They were seeking this amazing independent experience. And then they couldn't. And then they had to go back into a situation. And with all this like unknown and variability and remote, hybrid, mask, vaccine, like all these like different factors that we never had to deal with. It was just
Yeah.
like you go to school, you come home. So a lot of different, and I'm sure there's more, but those are just on the top of my mind at the forefront that I see very commonly that sort of fuel people's anxiety.
Okay, parents, if your Christmas shopping list looks like toys that don't end in tears, meltdowns, or glitter explosions, listen up. Play Therapy Supply is basically Santa's workshop for neurodivergent kids, but with actual purpose behind the play. We're talking fidgets that calm instead of overstimulate, social skills games that don't feel like homework, and sensory tools that help your kid's nervous system chill the heck out. If you've got an ADHD kiddo who's curious, creative, and occasionally climbing your curtains, this is where you'll find gifts that meet them where they are and build the skills they need. So skip the cheap plastic chaos this year. Hit playtherapysupply.com and fill that cart with gifts that actually make sense for your beautiful, busy-brained kiddo. Because a regulated kid is the best gift you can get this season. Dr. Laura, I had a bazillion other questions, but I truly think what would be most valuable to our audience right now is for us to cover some coping skills for anxiety.
Okay. That's a great question. And they are so applicable for everybody, even if they don't have an anxiety disorder. So, my most favorite foundational coping skill is deep breathing. And I have to say, this is not take a deep breath. Just take a deep breath because people think that that's helpful. And in fact, that's annoying to a lot of people in the moment who are anxious and they think if I knew, I would just like do that or just relax. So the goal, yes, will be deep breathing and relaxation, but it's not as simple take a deep breath. So what I like to teach is identifying on a 0 to 10 scale your level of discomfort. You could apply this for anxiety, you could apply it for anger too, irritability. So 10 being like, I can't stand this. I'm crawling out of my skin. I feel like this is unbearable. And 0 being, I'm floating on a cloud. Like I'm so lovely and so relaxed right now. And we try to teach. So if you're like in a 0 to 5, that might be okay, that you might not need to do anything. Because if you're going to do something like go on a date with somebody new or a job interview or take a test, we would expect a low level of anxiety to be there that prompts you to prepare, to ask questions, to pay attention, to try to research things ahead of time. But if it's problematic, if that 0 to 5 is a problem for you or you're above that, then deep breathing is a great go-to. And there's a whole bunch of different techniques for doing that. But at the basic understanding here, most important, is that the breath goes down low into the deepest part of your lungs. So you're really looking to push your belly out. Like, so many people will put a hand on their belly button, and you want, when you draw the air in, you want that hand to rise and fall. And you could put another hand over your heart, and you want that hand to rise and fall a little bit less than the hands on your belly. And that is key because so many of us were taught when we were younger, taking a deep breath. I know people can't see me, but I'll demonstrate. Like it's a whole like your shoulders are like coming up. It's a whole body movement. And really, that's a shallow breath and can lead you to feel like you're hyperventilating. So people will come in and say, I do deep breathing. It doesn't work. And then when we look at the technique, we realize, well, it's actually, you think that you're doing deep breathing, but you're not. You're actually getting shallow breaths in. So the key here is you want to push your belly out on the in breath and then exhale completely and fully out on your out breath. So that's the basic goal. As far as the strategies, there's a few, and I give out, and I'll give some now for people to choose. So one is just the simple in through your nose, out through your mouth without counting, just however long feels comfortable for you to push the belly out, and however long feels comfortable for you to get the air out. Generally, it's recommended to exhale a little bit longer than when you inhale. It's just helpful for reducing your heart rate, which often comes up when we feel that anxiety. And there's a nerve called the vagus nerve, and it runs right down through your abdomen area. So when you breathe out and you push the belly, it massages that and it tells your body to chill out. That's one of the reasons why the deep belly breathing works, because it turns off the sympathetic nervous system, which is the stress response, and turns on the parasympathetic nervous system, which is the relaxation response. And you can't have both on at the same time. So a second coping skill is remembering. So we use cognitive. I practice cognitive behavior therapy. So cognitive is all about your interpretations, how you're thinking about everything. And behavioral is things that you're doing. And we combine them. And I'm simplifying here, but it's very hard work and it takes a while to sort of like learn all of these skills and have them all come together. So while you're breathing, some people like to bring in that cognitive piece and they prefer a counting approach. So they might count to 4 while they breathe in and count out to 5 when they breathe out. And they like that focus on the number, not so much the focus on the breath. Other people get distressed with counting numbers and they're like, did I miss the number? Did I count wrong? Did I count too quickly? Were they evenly spaced? And they prefer to just focus on the breath itself. And both are okay. There's others like alternate nostril breathing, box breathing. So that I'll say for like, if you come for therapy, like we'll find something that specifically feels good for you and is easy to apply. Now, with deep breathing, many times we're not in a situation that you can like close your eyes and lay down and start deep breathing for 10, 15 minutes because it happens while you're driving, when you're at work, when you're at school, when you're in a classroom. So you can, I recommend usually to practice that when you're already calm, maybe before bed, you're already laying down, and do it for like 10 minutes, which does feel like a long time. So you can work your way up to it. And consistently be breathing so that you can train your brain and your body to connect in that way so that when the anxiety comes in the moment, you're not busy learning how to do the deep breathing. You have that skill and you can implement it. So I've had a lot of for me, I've had a lot of dental work and I use deep breathing all the time, getting the Novocaine shot and dealing with a root canal. Like you can do, if I can do it in the dentist chair, like you could do it anywhere and having that deep breathing. So that will bring down the physiological response of the anxiety. Cognitively speaking, how we're interpreting a situation matters with how you feel. So being mindful of that is another really important coping skill. And we teach a skill called cognitive reframing, which is sort of like if you have a picture and you put it in a blue frame, it looks one way. If you take that same picture and you put it in a green frame or a red frame or a yellow frame, that the picture might pop a little differently. You might notice details that you didn't look before. The same is true for our thinking and for our mind. So changing the way that we think about a situation, not making it up, it's all wonderful and flowers and sunshine, but being realistic about a situation. So if you find yourself thinking like, I'm never going to do well in this class, I'm terrible on a date, I stumble over my words, I'm terrified of this professor, I don't like this kid on the playground, and that's probably leading to the feelings of the anxiety. So we target those thoughts and look at them. How accurate are they? Are they helping you? Are they unhelpful? Is there another more helpful way to think about this situation that we can apply, and then we can sort of prevent the physiological response altogether? And keeping in mind that anxiety is not like a switch that you just turn it off and like all of a sudden you feel better. So with that 0 to 10 scale, if you're at an 8 and you start using a coping skill, especially deep breathing, set the goal to say, I'm going to bring it down to a 7, then maybe a 6, like a gradual bring down so that you see that you're heading downward will give you the courage to keep going so that you can calm down even more. And there's also, I won't go into all the details, but there's meditation, there's mindfulness, there's visualization, there's progressive muscle relaxation, and others. There's so many coping skills, and that's a big part of therapy, cognitive behavior therapy, especially. It's very effective for anxiety, for ADHD, for OCD, where we're really looking at you as an individual, exactly the areas that you're struggling with, specifically, personally for you, and we work on goals and we teach you skills and interventions and a way to practice them and a way to work through them. That's why I meant like the work happens between the appointments. It's not like what people think you come in, you lay on a couch, you talk, and then you leave. It's not like that. It's very interactive, very problem solving oriented, very effective. And I like to make people feel uncomfortable. That's part of my job. But we work on being comfortable with being uncomfortable. And that's like the
Mm.
crux of managing so much anxiety. It's like I can be comfortable even though I'm uncomfortable, and that's okay.
Yes. That's so good. I am going to practice with my kiddo after our story time on belly breathing.
Yes.
I had a really cute story I wanted to tell you before I'm sure our audience is dying to figure out how they can get in contact with you.
Sure, yeah.
When you were saying that we shouldn't check our kids out of school, every Friday I go eat lunch with my kiddo at school, and
Oh.
every Friday is Fun Friday.
Mhm.
So at 11 o'clock, he's begging me, like, Mom, please just check me out. Please just check me out. Please, I don't want to go back. And then right after that is Fun Friday, where they get all three of the fifth grade classes together and they have so much fun. So every Friday at 11, he's begging me to take him home. Every Friday at 3, he's telling me how much fun he had.
Yes. Isn't that so true? That's so great. I just love that they have what a special time for having parents to come in, assuming that a parent has the capability to do that. But what a special time to have that connection in their day that mom or dad or a special, parent or caregiver can be there with
Yeah.
them. And yeah, then wow, look at all the fun he has stay after. That's so wonderful. Thank you so much for sharing that story. I love it.
No problem. Maybe it will help other parents resist the urge to cave to the anxiety and say, okay, just come home.
Yeah, yeah, because it's easier. We call that negative reinforcement, by the way. It's like
Mm.
when we can escape the like an aversive situation. So think about like when you get in the car and your seatbelt, like the sound's going off, and you're like, I plug it in and it stops that. When your kid's distressed and you're like, I could just stop this if I just pull them. And then you get reinforced as a parent for that because then your stress goes away, their stress goes away. But resist.
Yeah.
Be strong, breathe, wait it out, and you'll get through that. And also make sure that it isn't truly a safe situation. Because
Yeah.
side note, like sometimes anxiety shows up because there is actually like a real true problem.
Yeah.
Bullying, for example, like that needs to be addressed. So listen to your kid, but once you assess what's what, then you're better prepared as a parent to make the right decisions.
Yeah.
Yeah.
So now I need you to tell everyone, especially college kiddo parents, how they can get in touch with you and work with you further.
Oh, perfect. Okay, so I have a website. I have two names, but they both point to the same website. So meaningfulpsychservices.com or onlinetherapyforanxiety.com. Those will both point to the same website for me. That will have my most up-to-date information on there with my contact information. My email is also Dr. Laura at onlinetherapyforanxiety.com. You can email me there. I am on Facebook, and Twitter and LinkedIn. So there's a few different ways there too. I do have an Instagram, but like I have not used it. I think I'm just too old now. I don't know. It's on my to-do list. So you're probably not going to find much content for me there, but my website is a good go-to for me. I do return phone calls. within the same day. So Mondays, Tuesdays, and Wednesdays are the days. If you contact me on that day, you'll get a call back or an email back that same day. If you contact me other times, you have questions, I will get back to you. I never let something go.
Very nice. And of course, I'll link all of your websites and connections in our show notes so people can get in touch with you.
Perfect.
Dr. Laura, this has been amazing. I'm sorry to completely let anxiety take over our convo today, but I think it's been so helpful.
I hope it is so helpful. Anxiety likes to do that. take over things than do. And I hope it's helpful and people feel a little bit better and about how to get better. That's an important distinction that I learned. It's not always about feeling better. That's important, but true getting better requires skills and work and lots of practice, whether it's ADHD, OCD, anxiety, it's possible.
I always ask for parting advice, but I think that was the perfect ending right there.
Oh, good.
Thank you so much for your time today.
Oh, thank you so much. I appreciate it.
Wow. I don't know about you, but my brain is spinning and my little mom heart is full. Huge thanks to Dr. Laura for dropping so much knowledge in such a digestible, relatable way. Be sure to let me know what really stuck home for you. I think you can hear my most shocking moments throughout the episode. Remember, parents, anxiety doesn't have to run your home or your kiddo's life. With the right strategies, mindset shifts, and maybe a little help from a pro like Dr. Laura, we can actually breathe again. If you loved today's episode, please do all the things for the algorithm gods. Hit subscribe so you never miss another episode. Like and leave us a review, 5 stars obviously. But more importantly, share it with the ADHD parents in your life. You know, the ones who are probably hiding in the bathroom eating their kids' Halloween candy. And don't forget to check out Meaningful Psychological Services in the show notes, because sometimes getting help from someone who actually gets it is the best gift you can give your family. That's it for this week on Chaos and Caffeine. I'm your host, Danielle, your ADHD parenting bestie. And I'll see you back here next week for a lot of the same hot mess chaos and probably too much caffeine, but I promise to bring a new conversation. You know those nights when you're up at 2 a.m. Googling, why did my child blow up over nothing? Or how do I explain instructions that don't take off like a rocket? Meet Dr. Lorian Phillips, a clinical psychologist since 1995 and in the ADHD trenches with families since 2013. She isn't just someone who studies kids. She's raising them, parenting them, figuring this stuff out live. Dr. Phillips runs what may feel like your dream support system, an ADHD parenting course she started in 2013, plus private consults to help you read your child's wiring instead of fighting against it. She's spoken at schools from nursery to high school. She teaches ADHD families emotional regulation and all the skills that we need to feel successful and not broken. If you're overwhelmed by the constant, did I say that wrong? Moments, knowing there is a way forward with understanding, empathy, structure, and celebration, Dr. Lorian Phillips is someone you'll want in your corner. For more, check her out at adhdmanagement.co.za or click the link in the episode show notes to connect with her from wherever you are.